you, Brad. At Team Toronto, which consists of all of our hospitals, community partners, pharmacies, and city-run clinics, the team continues to make great progress getting people vaccinated. And I'd like to take this opportunity right at the outset to say thank you to them all, because when I've seen them, whichever part of the team they work for and with, everybody's doing a superb job in good humor and a great spirit of public service, and I want to say thank you to them. And their work has resulted in the fact that we have administered more than 2.75 million doses, and we're hitting milestones that matter when it comes to the next steps of the provincial reopening. This week, Team Toronto hit a new vaccination record. Our 7-day average is 44,675 total doses a day, which is an all-time high for Team Toronto. Yesterday, more than 20% of adults in the city, more than 500,000 people, have already received a first and second vaccine dose. Just a week ago, we were at 10%, so we've improved 10% in 1 week. That is great progress. And we're a few thousand vaccine doses away from having 75% of adults in the City of Toronto with their first dose of vaccine. Both percentages are important when it comes to the provincial reopening roadmap. But just as importantly, it shows a determination among so many Toronto residents to get vaccinated, to protect themselves, to protect their loved ones, and to protect our success in fighting COVID-19 so that we can get on with reopening and just get on with our normal lives. The push for people to get their second dose is on. For the first time this week, we've seen our city-run clinics go from about 2/3 first dose and 1/3 second dose to 50-50, and we expect that strong shift to second doses to continue. We can see that this week in the rush to book appointments in our city-run immunization clinics. With the eligibility lowered for people to get vaccinated, we saw 60,000 appointments booked in a few hours on Monday, and the 30,000 additional appointments opened this morning, with just 8,600 appointments remaining now out of all of that until the start of July. I want to thank people who've stepped forward and continue to step forward to get vaccinated. And I also want to continue to reach out to people who haven't got their shot yet to urge them to please get vaccinated. We are determined to make sure that everyone who hasn't been vaccinated yet gets vaccinated to protect them from COVID-19 and the Delta variant, and to make sure that our city as a whole has the best protection possible. In that regard, in terms of encouraging people to get vaccinated and helping them to take down barriers that might exist, we announced 3 weeks ago the VaxTO campaign to help connect Toronto residents with COVID-19 vaccination appointments and information. Throughout the pandemic, we've taken unparalleled efforts to address lower vaccination rates when it comes to race, income, and other factors. Our community partners and ambassadors are doing great work on the ground in hotspot areas, and in many cases going door to door to make sure people know how to get vaccinated and helping them to get their shot. Alongside those efforts, we have worked to target vaccination efforts in hotspot areas where we know essential workers live, for example, and now, through the Sprint Strategy 2.0, in areas where we know more vaccine doses are needed to combat the Delta variant in particular. VaxTO builds on that foundation of good work we are doing with our partners in communities and uses techniques similar to what you'd see during an election campaign to make sure that you use technology and use good old-fashioned door knocking to get every single person you can to make sure they get vaccinated, make an appointment, and actually get to the appointment. Since its launch on May 26th, the VaxTO campaign has seen some great success in its engagement with Toronto residents. Specifically to date, for examples, over 870,000 phone numbers have been called across the city through the campaign's interactive voice broadcast messages. Out of those calls, 6,200 people have been automatically patched through to the provincial booking line. They simply have to press a key on the phone to be patched through. Over 840,000 people have been reached through targeted digital ads, and over 10,000 messages have been received via the COVID-19 text line. The three of us, Dr. Davila, Chief Pegg, and myself, took part in the campaign's first citywide telephone town hall on June the 2nd, and we're pleased to provide information on that occasion to more than 58,000 participants. Usage on the VaxTO text line has doubled since we updated it with new features to make it even easier for residents to connect to the vaccine information they need, including 14 new language options and a new postal code lookup that provides residents with a list of their nearest city-run vaccination clinics and pharmacies. Moving forward, the campaign will focus on more targeted and localized outreach, aligning with Team Toronto's Sprint Strategy 2.0 efforts to provide access to first and second vaccine doses in neighborhoods with a high incidence of COVID-19, low vaccine coverage, and where the Delta variant has been identified. This includes more targeted telephone town halls, broadcast voice messages, and digital ads. Specifically, starting tonight, the VaxTO campaign will run 5 local town halls in June, hosted by city councillors, with panelists including Chief Pegg, an Associate Medical Officer of Health from Toronto Public Health, and vaccine team engagement leads. A multilingual digital and social media campaign is also set to begin in July and will feature digital ads in over a dozen languages on platforms such as Facebook, Instagram, Reddit, Snapchat, and WeChat. Toronto residents wanting to connect with the VaxTO campaign information and get information about clinics and town halls and all of the features are encouraged to text the word vaccine to 1-833-750-0888. This is about making sure that we are doing everything we can as a city government to connect with residents across our city and help them to get vaccinated. And if we have more supply, we can do even more. We continue to have capacity to treat and vaccinate even more people, and we're looking forward to meeting that challenge and to continuing to push the numbers up with your cooperation. Now I'd like to ask Dr. Davila to deliver her update for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 84 new cases of COVID-19 in Toronto. 605 people are in the hospital, 178 people are in the ICU. I'm sorry to say that there have been 7 more deaths from COVID-19. New polling released Monday found that in Ontario, 89% of respondents have or will be vaccinated against the virus. This is important and reassuring because as we push through COVID-19 vaccinations in the next few weeks, it has to be all hands on deck. To one degree or another, the Delta variant poses a demonstrated risk of infection to anyone who is not fully vaccinated. And that's everyone who has only had 1 dose of vaccine or had none at all. From a health point of view, I'm most concerned today about people who haven't been vaccinated at all, particularly the older you get. For the rest of us, what happens with Delta could cause problems that may disrupt reopening and moving forward to where we all want to be. So all of us needs to get or complete our vaccinations as soon as possible. I want to give you a quick snapshot of Delta, given how events have unfolded in the United Kingdom, where Delta is dominant and the news is mixed. Monday night, the government in the UK delayed the final stage of lifting public health measures until July 19th. Would have ended all limits on interaction between people in all settings. The restrictions affect the size of gatherings and public events, and significantly, the ability to travel, which is frustrating in everyday life and adds more hardship for everyone who earns their living in tourism, travel, and hospitality. It couldn't have been easy for the government in the UK to take this step. But 55% of the population in the UK still has had either just 1 dose or no vaccination at all. And more than 90% of new COVID-19 cases there are Delta variant. The Delta variant is now understood to be more transmissible than the Alpha or the B.1.1.7 variant, which was itself at least 50% more transmissible than the original COVID-19 virus. Indoors, Delta is measured as 64% more transmissible than the Alpha variant. Outdoors, Delta is estimated to be 40% more transmissible. In the United States, cases rose by 1.3% in the last week, but not evenly. States where vaccination rates are high continue to see cases fall. States where vaccination rates are low are reporting rises. The Centers for Disease Control and Prevention reports that 6% of new infections overall are because of the Delta variant. Certain states report that figure to be as high as 18%. The facts could not be any clearer. Where there's high vaccination levels, Delta doesn't appear to be a huge threat. Where vaccinations are low, it either is or could be. Here's the good news though, and it really is good news. Overall, if you have both doses of vaccine, your level of protection from Delta is very high. Public Health England says the vaccines are over 90% protective against hospitalization after 2 doses. When an illness doesn't send you to hospital, that's a good thing. Here in Toronto, we're approaching 75% of residents 18 and older who've had a first dose. 20% are fully vaccinated. That's remarkable. It's reassuring. And most importantly, it's protection. Protection for them and protection for all of us. In that respect, we will continue to deliver vaccines to everyone who lives in Toronto while focusing attention and resources on areas of the city where the risk of COVID-19 is highest and where improved and increased vaccination coverage will create the most protection overall. Where there are increased risks to some of us in the city, then all Torontonians are at risk too. This week and next, the youth vaccination blitz continues throughout the city, building on the 57.5% of young people who've now received a first dose. There are 20 focused youth clinics across our city this week, and a dozen more planned so far for next week. If you're between the ages of 12 and 17, now is your time to get your vaccination if you haven't already, so that you can receive your second dose before back to school in September. While youth getting vaccinated must receive a Pfizer vaccine, vaccination efforts are being made easier as the Moderna vaccine will be added in significant numbers in Toronto. We're expecting almost 102,000 doses of Moderna in the next few days, with another significant infusion expected again next week. This supply will be divided between the city's mass immunization clinics and our vaccination partner network to move the vaccines to people as quickly and as widely as possible. Canada's National Advisory Committee on Immunization, or NACI, has found no important difference between Moderna and Pfizer. NACI considers these mRNA vaccines to be interchangeable. 129 million doses of Moderna have been delivered in the United States alone. Canada, the United States, and members of the European Union are amongst the more than 40 countries that have granted the Moderna vaccine authorization for use. The new quantities of Moderna vaccine that are coming to Toronto and the whole province couldn't come at a better time. The time is now. We have the vaccine supply, and we have the places to deliver it. city-run and hospital-run immunization clinics, pop-ups, and mobile clinics. Above and beyond this, supply is being provided by the province to doctors' offices and pharmacies. The main thing to remember is we're in a strong position at this point in time, so long as we work to keep it that way. Often, during the pandemic, I told you the future was in your hands and under your control. It's never been easier to take that control, and I'm asking each of you to take it and begin or complete your vaccinations so that we can drive our vaccination coverage and our safety and protection to new heights. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. At 8 o'clock this morning, we opened an additional 30,000 vaccine appointments in city-operated clinics between June 22 and June 27th. These additional appointments are the result of additional Moderna mRNA vaccine being allocated to us by the province of Ontario. Next week, the City of Toronto will receive 162,630 doses of the Pfizer mRNA vaccine. 60,102 of those doses have been allocated to city-operated clinics, 36,000 doses to the Sprint strategy, and 66,528 doses to our Team Toronto partners. Also next week, the City of Toronto will also receive 101,000 doses of the Moderna mRNA vaccine. 30,000 of those doses have been allocated to the city-operated clinics, 20,000 doses to the Sprint strategy, and 51,000 doses to our Team Toronto partners. As Dr. Davila explained, both Pfizer and Moderna are highly effective and safe mRNA vaccines that are able to be used interchangeably in adults. The additional 30,000 appointments that have been opened within the provincial booking system appear with the name of the clinic, followed by June 22 to 27, followed by the words adults 18 plus only. The reason for the inclusion of the wording adults 18 plus only is that everyone who books into one of these 30,000 appointments will receive the Moderna mRNA vaccine. At present, the Moderna mRNA vaccine has yet to be approved for administration in youth aged 12 to 17 in Canada. As such, we have listed these appointments as being for adults 18 plus only. These additional 30,000 appointments are available for both first dose and second dose appointments. As Dr. Davila explained, the National Advisory Committee on Immunization has indicated that anyone who received a first dose of the Pfizer mRNA vaccine can safely and confidently receive a second dose of either the Pfizer or Moderna mRNA vaccine, and vice versa, resulting in them being fully immunized against COVID-19. The city will be contacting everyone who books into one of these 30,000 appointments in order to ensure that they are aware of the 18 plus age requirement. Upon arrival at the clinic on the date of their scheduled appointment, our clinic staff will know which appointment slot each individual has booked into. Each person will receive the vaccine associated with the appointment slot they selected. There will not be an opportunity to select nor change the brand of mRNA vaccine that is administered at the clinic. We are continuing to work with the Province of Ontario with respect to confirming vaccine allocations for July 5th and onward. As soon as we have confirmation as to vaccine allocation for that time period, we will open additional appointments in city-operated clinics for the week of July 5th. Beginning July 5th and thereafter, each city-operated vaccine clinic will administer both Pfizer and Moderna mRNA COVID-19 vaccines interchangeably, based on the availability and supply of vaccine. Our collective ability to remain ahead of the Delta variant is largely dependent on our ability to get as many people fully vaccinated as possible, as quickly as possible. Everyone who is 12 years of age or older continues to be eligible to receive their first dose of vaccine. The province of Ontario has also made a number of groups of people eligible to receive an accelerated second dose of vaccine. The details on each of these groups can be found at toronto.ca/COVID-19. Anyone who received a first dose of mRNA vaccine, along with anyone who received a first dose of AstraZeneca vaccine who wishes to receive an mRNA vaccine as their second dose, is eligible to book their second dose appointment via the provincial booking system, which is accessible again from toronto.ca/COVID-19. If you prefer to either book or reschedule your appointment by phone, you can do so by calling the provincial call center at 1-833-943-3900. If you received a first dose of the AstraZeneca COVID-19 vaccine and you prefer to also receive a second dose of the AstraZeneca vaccine, please contact the pharmacy or primary care provider where you received your first dose. AstraZeneca vaccine is not allocated to city-operated vaccine clinics. Both second dose options for those who received their first dose of AstraZeneca vaccine are safe and provide strong protection against COVID-19 and will count as a completed immunization series. As of 12:30 this afternoon, there were 8,600 appointments remaining available in our city-operated vaccine clinics between June 14th and July 4th. This includes appointment slots for both brands of mRNA vaccine. For vaccine opportunities outside the network of city-operated clinics, please go to vaccineto.ca for opportunities that may exist in our Team Toronto partner clinics. For those active on social media, I encourage you to follow Vaccine Hunters Canada on Twitter for additional information on opportunities to receive COVID-19 vaccine in Toronto. Please ensure that you cancel your appointment via the provincial booking system or the provincial call center in the event that you will not be attending your scheduled appointment. I continue to encourage everyone who is 12 years of age and older and who has not yet received their first dose of COVID-19 vaccine to book your appointment as very soon as you are able. Thank you for all that you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions. Just a reminder to please unmute yourself. We'll go first to Jane Stevenson from the Toronto Sun. Jane, go ahead, please.
Yes, I'm not sure if anyone on the panel, maybe somebody on the phone can answer this one. There was a story out of Ottawa today that indicators of COVID-19 in city wastewater have risen in recent days to levels not seen since early May, when daily case counts were in the triple digits in the city. And I guess Dr. Doug Manuel said the increased wastewater signal being seen in Ottawa is, in quotes, similar to what preceded surges in the past. And I guess I'm just wondering if Toronto is monitoring the city wastewater and if this is a concern.
Doctor?
So thanks, Jane, for the question. We do have data, and we are participating in wastewater surveillance here in the city. Perhaps a little more complicated an affair here, just given how significant our wastewater operations are. I would say this, the last data I saw suggested that things were on the decline. We are, of course, monitoring, and I will look into that, which is our most current data, as I get the reports on a regular basis from our team.
And just as a follow-up then, Dr. Dula, do you know when that last report was? Was it a week ago, 2 weeks ago, days ago?
Yeah, it was a few days ago. Honestly, Jane, I can't tell you the exact day, but we do get regular reports every week from the team, certainly.
Okay, thank you.
Thank you.
Thank you, Jane. We'll go next to Dave Woodard from Global News Radio 640. Dave?
Thank you. Good afternoon, Mayor Tory. My first question is for you from a colleague with Global National. With Victoria City Council deciding to not do Canada Day celebrations, should Toronto continue having Canada Day celebrations, given the heaviness of Indigenous issues right now, especially in the light of the discovery of unmarked burial sites in Kamloops?
Well, of course, the discovery of unmarked burial sites in the West and possibly to be followed based on exploration that's being undertaken now is a great tragedy and something that people right across the country, I think, have embraced as something that we should be reflecting on and taking action on as Canadians. In the case of the City of Toronto, we've already canceled our city-run Canada Day celebrations because of COVID-19. I think that there will still be a Canada Day, and I would hope that part of what takes place that day, in addition to celebrating this great country that we're so fortunate to live in, will be some time of reflection on these issues that have confronted us for a long time with respect to the treatment of our Indigenous people, and I'll leave it at that.
Okay, thank you. And with Canada's Wonderland slated to reopen July 7th, Mayor Tory, are you considering reopening things like the CNE for this August with safety measures? And further to that, do you agree with Brampton Mayor Patrick Brown that we should be moving into stage 2 earlier than anticipated?
My view throughout with respect to the provincial roadmap is that they did a very good job of having a clear and very concise plan that had specific dates attached to it, very specific thresholds attached to it. There were a number of them. It wasn't just vaccination rates; it was also hospitalization and other things like that. And I would abide by public health advice in this regard, but I think it is best from the standpoint of consistency if we stick to the plan. The province put forward the plan. I think it's best if we stick to it. And we're just trying to push every single day to get as many people vaccinated as we can and to make sure that people continue to follow the public health rules. With respect to some of the public events, let's remember that in many cases those were canceled because the organizations needed to make a decision back some time ago when the situation was still quite dire. They had to sign contracts, hire people, and do things like that. And I think that that was a main consideration in many cases when they came forward to us and said they wanted to cancel the event or that they were intending to do so. In other instances, it is the difficulty that's involved in having events like that and controlling the number of people that are there in a crowd. What if you said you were going to go ahead with some of these events and then it turns out we hadn't yet reached the thresholds necessary for, say, stage 3 of the roadmap opening? Then you've signed contracts, you've hired people, and there's a problem of an even bigger financial problem for those organizations. And so I would say that it is likely the case, and I can't speak for them, but it is likely to be the case that those things that have been canceled would remain canceled. But I suppose it's always possible there could be some modification to how those events are held, but at the moment I'd say it's more likely they'll remain postponed for this year, and we can look forward to celebrating those events again in 2022.
Right, thank you very much. We'll go next to David Ryder from the Toronto Star. Go ahead, Dave.
Hi, everybody. My first question will be about the incidents we've seen on the beaches with fireworks and et cetera. Is there anything to talk about closing any beaches? And also just built into that, as Mayor Tory, you had suggested maybe limits on fireworks on Canada Day. Can you tell me where we are with that?
Well, the situation is such that when it comes to beaches and parks, let's be clear, fireworks are banned all the time. There is no allowance for fireworks, and so the people who take any fireworks to a beach or to a park are, if they intend to use them, they're breaking the law. And of course, we've had outrageous examples of people not just using them, which is against the law, but using them to fire the Roman candles at other people and at police officers in some instances. That is completely unacceptable, antisocial, just ridiculous behavior, and we do our best. I mean, when I say we, all of the different enforcement mechanisms and people who are parks ambassadors and so on, to see that that kind of behavior doesn't happen. But the beaches in particular are a very difficult place to control crowds. And the one thing you don't want to do, especially in the middle of the summer, is to close the beaches. So that isn't something that's been contemplated. We've taken steps like closing parking lots earlier, keeping an eye out for huge quantities of alcohol, which tends to influence this behavior onto the beaches and so on. But if you think about how people can access the beaches from all kinds of access points up and down the shore, it's a very difficult thing for us to exercise control. So, it's back to the same old thing. we have to count on people to behave themselves, to encourage others to behave, not to even think of taking fireworks to the beach, let alone using them, to limit the amount of alcohol they consume and frankly that they take to the beach. They're not supposed to take any, but we're not running around giving a lot of tickets for that. It just has to be people that decide they're going to behave responsibly. We certainly had lots of enforcement resources at the beaches last Sunday, but no matter how many you have, it's almost impossible to completely control what goes on there. So I just hope that people can do better as time goes on. There's patios open now to provide additional entertainment options for people, and I just hope people do better, because it's up to people to do better, the vast majority of whom do. It's just a small minority that, as usual, cause this question to be asked.
Thank you. And follow-up is for Dr. Davila. Dr. Davila, it seems pretty certain now that first the increase in the vaccination rate for first doses is flattened or slowed down dramatically. Is that natural, do you think? I know there's plans to try and keep it going, but is that a result of anything in particular beyond the fact that all the early adopters have already adopted?
Well, I think there are a number of factors there, David, and certainly I can say we were talking about this earlier, and I understand that at our own city mass immunization clinics, we're still seeing about a 50-50 split between first doses and second doses. So certainly glad to see that there are people coming out to get that first dose, and of course, as second dose eligibility has opened up, we are not surprisingly seeing people coming out to get that second dose. But as you mentioned, we are absolutely continuing to really focus on those areas where we know first doses are still needed, areas of the city that have seen more transmission and that have been more impacted by COVID-19 in particular through the sprint strategy. You heard the mayor speak about our sprint strategy efforts and all the other efforts that we've put forth in respect of increasing vaccination coverage, both for first dose and second dose. Whether it's around communications campaigns, ensuring people are aware of the opportunities, homebound vaccinations, community ambassadors, transportation supports. These are just a few of the kinds of things that are out there, over and above the pop-up and mobile clinics that make it easy for people to get vaccinated. It's this whole suite of things that we think really will help to drive up vaccination coverage as high as we can get it.
Okay, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead.
Thank you very much. I'm just curious to know, both Dr. Davila and perhaps Chief Pegg, we talk about the amount of appointments that are still available and trying to get everybody their doses. And then over the last few days, obviously, we've seen some frustration, confusion over people trying to book those appointments, despite the fact that there are still some available, including one of the Team Toronto partner clinics having lineups throughout the night just to get the people in the door. Why is it that it's become so difficult for people to get their appointments when there are still appointments available, perhaps at city-run clinics?
You want to start, Chief?
Sure. So I think first what I would say, Mark, is I'm actually encouraged by the fact that the demand for vaccine, both first and second dose, is so high. As we talked about earlier, we opened an additional 30,000 appointments in the provincial booking system this morning for appointments that run between the 22nd and 27th of June. That's next week. And those appointments have largely filled already today. So we're in it's this awkward position because the three of us and the whole city would like to be in a position where there was no limitation or no shortage or no compression on the availability of vaccine. That's not the reality. The reality is there are still fixed amounts of vaccine. I detailed them out in my remarks. We administer every single dose of vaccine that is allocated to us by the province. As vaccine supply increases from the Government of Canada through the province, we are ready to deliver more. But so every dose that we receive, we open an appointment for. I appreciate very much that navigating the systems and navigating the various booking systems can be a challenge. It undoubtedly can. And first and foremost, I want to say thank you to everyone. By and large, people are very patient, they are very tenacious, and very diligent at booking their appointments, and I certainly appreciate that, and we're seeing the results of that translate into the vaccine rates, and really the corresponding infection rates that are coming down. So as we move forward, I think it's going to take more of that patience. We continue to do everything that is available to us in order to streamline and simplify and really to streamline the communication around those processes, and we'll continue to do that. But there are going to continue to be a number of different avenues, a number of different vaccine providers across our Team Toronto network, and that will obviously continue to be a factor as we move forward. Dr. Davila?
Yeah, so I'm going to echo what the chief said. I'm certainly heartened to see that people are interested in getting vaccine, whether it's a first dose or second dose, and I would encourage people not to give up. We recognize, as the chief indicated, that there are many channels and, information is changing on a pretty regular basis. So I can appreciate and understand that it is difficult to keep on top of it all. But there are a number of resources out there that can help. Certainly you can call us at Toronto Public Health at 416-338-7600. We can start to help and help navigate the system. There is great information on our website as well for those who have access that can direct you and help you find options that are available. We have community partners out there absolutely interested in helping you get to your vaccination appointment. We've got transportation options. I think there are a lot of resources out there all pulling together in the same direction because we know how significant getting our city vaccinated is in terms of getting us to the other side of this pandemic. So I would encourage people, please don't give up. There are many resources available out there. People willing to help. Do reach out, and we'll do our very, very best to get you to that information that you need so that you can get appropriately vaccinated as soon as possible.
Tory?
May I just follow up on something Chief Pegg said? We allocate appointments based on the vaccine that we know we have available so that we don't have to cancel appointments, and we move the vaccine around as people may not come for their appointments or something like that. But make no mistake, we could use more supply. We have more capacity to administer vaccines to more people if we had more supply. And the province has been good at recognizing the fact that in this city of Toronto, we have more hotspot areas where people have been infected over time or maybe are more vulnerable to the Delta, or where there are just lower rates of vaccination. And if we get more supply, then we can do more, and that will help to meet this demand that exists out there. But a lot of it is governed by supply, and we have been ready from day one with capacity beyond what we have fully utilized as yet, so that we're ready to do more if we can get more.
Thank you. That's an interesting point, Mr. Mayor. Dr. Davila, in her comments, said we have the vaccine supply and the places to deliver it. So which is it? And if we know the vaccine supply is in fact coming, per Dr. Davila's remarks, why can't we open up more appointments available beyond the dates you already have set up?
So if I can, I don't know that that's an either or, it's a bit of both. I have asked the province every day, can we get more vaccine? And as we get more vaccine, we use it. And you've seen the kind of demand that we have out there, both for first and second doses, which is a good thing. So, as far as I'm concerned, our goal, along with our many vaccination partners all around the city, is to use the vaccine we have as quickly as possible and spread it particularly with focus on those areas that need it the most. But absolutely, we want as much of the city with vaccination coverage as soon as possible. And as we use up doses, which we are doing, we ask for more vaccine. That's exactly how it goes. That's been the story, I think, throughout the entire time that there's been vaccine available to us.
All right, thank you. We'll go next to Matt Bingley from Global News. Matt?
Hi there, Dr. Davila. Last month, the Centers for Disease Control put out clear guidelines for safe behaviors when it comes to people who have been double dosed. As of yet, Health Canada has not done something like that, and I'm just wondering when you would like to actually see them put out clearer guidelines, and if you think that that would actually make your job easier for passing on the message to people in Toronto.
I think that any time that there are clear guidelines provided by higher levels of government, particularly for those issues that affect a broad swath of the population that aren't really managed at a local level, it's always, helpful to have that kind of clear guidance provided. I also recognize that when we're talking about something like COVID-19, new virus still, new and emerging variants about which we're still very much in the learning phase, learning quickly, but still learning. I recognize that this is very challenging to do. So I do know that there are a number of conversations, as you can well appreciate, are happening both at the provincial level and at federal tables as well. We'll look forward to hearing from them, as we always do. But in the meantime, right, the main message to people here in the city is if you haven't been vaccinated, do get vaccinated as soon as possible. And for now, the best advice is to continue to practice all those self-protection behaviors that we have practiced for many, many months now. It is still the safest thing for us to do while we navigate our way through this, hopefully, last part of the pandemic.
And to follow up, do you worry with the fatigue factor that you're already seeing, that the longer you have to wait, that the more people are just going to make up their own minds as to their own personal risk?
Well, I think there's always a certain element of that, but what I have observed over the course of the pandemic is that the vast majority of Torontonians actually have really taken to heart practicing self-protection measures and doing the right thing, because frankly, I think we all want to protect our own health. We want to protect the health of those around us. And fundamentally, we want to get, our city back and restore some degree of life as we knew it before there was a COVID-19. And I do think that most people appreciate that the road or the path to get there is about getting vaccinated and about continuing to be cautious and practicing appropriate self-protection measures for now.
All right, thank you. We'll go next to Shalima Maharaj from Global News as well. Shalima?
Hi there. Thanks for taking my question. The first one, it comes down to vaccine clinics, and the Ministry of Health, they tell us that it's the responsibility of public health units to determine how vaccines are allocated. That includes to mobile and pop-up clinics and through the provincial booking system. We've been seeing people camping out overnight. We talked to some people in Scarborough who waited overnight for a shot at a second dose. Why not reallocate the doses you have to the provincial portal so that people don't have to line up for blocks for hours at a time and with little to no physical distancing?
So we'll see if anybody else has any think further to add, but let me start off with this. When it comes to the allocation of vaccines here in the City of Toronto, this is something that is actually done with our vaccination partners. We're really working hard to make sure that vaccines are available in as many channels as are possible. And we are also really focusing our vaccination efforts on those areas of the city where there is risk, where there has been COVID-19 transmission and where it continues to be, present, where we see more of the COVID-19 transmission happening. Hence, we have a pop-up and mobile strategy, and we have noted that this has actually made a significant difference. It has really increased vaccination rates in those hardest hit areas of the city and has improved coverage, and in accordance with that, we are actually seeing reductions in our COVID-19 transmission. So, simply put, I would say that the method of allocation actually allows for a broad range of channels for vaccine distribution, and in my estimation has been very effective in terms of achieving the outcomes that we wish to achieve, which is increased vaccination coverage and all the benefits that go with vaccine coverage as well.
follow up. So the other thing that I would ask, though, at the same time, I mean, we are seeing images of people who have been out there overnight. We've talked to people who've been out at midnight. One woman who was out at 1:30 in the morning waiting for a clinic to open up at 8 o'clock. Does that not concern you that there could be potential risk having all of these people congregating and for that long in close proximity?
So, I don't think there is any intention for that to be the case. That, the idea of having overnight lineups is certainly not the intention. My understanding is that when it comes to the mobile and pop-up clinics and the partners who are overseeing their operations, there are a number of different management strategies, line management strategies, to help try to alleviate or avoid those kinds of instances or situations from arising. I'm certainly interested to hear that this is happening. We'll bring it back to the table of our vaccination partners. And, as we have throughout the course of the vaccination campaign, we'll continue to refine our vaccination efforts so that we're achieving the goals of the vaccination campaign, making sure that we're getting vaccine out to those who need it, to those who have challenges with respect to access. We're trying to reduce barriers, but of course, we don't want to see unnecessarily long lines or people feeling that they have to camp. That's not the intention. We have always worked with our partners to try to improve the vaccination experience while at the same time increasing vaccination coverage as quickly and as efficiently as possible.
Thank you. We'll go next to Sneha Agrawal from the CBC. Sneha?
Thank you. We are continuing to see inequity when it comes to second doses. For instance, Forest Hill, one of Toronto's richest communities, to have more fully vaccinated people than Jane and Finch and Rexdale. We saw this with the first dose. Why is it still happening? Is the city's sprint strategy not working?
So, thanks for the question. I think in respect of what we're seeing now, this is due in large part to the way you have to space out vaccinations. So it's largely a function of when first doses and to whom first doses were given. That actually dictates or determines what happens in respect of second dose, because there is a spacing that needs to be respected in order for the vaccination to be considered valid. So that's certainly part of the issue. But, what we did see was that the sprint strategy, actually delivering vaccine, making vaccine opportunities easy for people, particularly in those neighborhoods that were most significantly impacted by COVID-19, does absolutely increase vaccine coverage in those areas. We saw that in the first round of our sprint. That's why our second round of the sprint is specifically focused on those areas, so that we can actually continue to build on the lessons that we've learned. And I expect that we will see that sprint strategy will continue to have the same positive effect in terms of reducing barriers to access and increasing vaccination coverage in those areas of the city that have been hardest hit by COVID-19.
Mayor Tory?
I can just really add to that by saying that what we're doing is taking the success, the great success that was enjoyed by the first phase of the sprint operation, which took single-digit first dose levels up to area levels equal to all other parts of the city, and just repeating the exercise, but with a lot of added resources. We're now adding in the local organizations headed up by councillors and community leaders, the technology we're using through telephone, texting, town hall meetings, and so on, a lot of what I outlined today. And so what we're doing is making a maximum effort to do the same thing over again, except better and faster. But we do have to respect the gap that exists between some of those first doses that did happen later, although successfully through the first sprint operation, and those people can't get their second dose until that time has passed. But we're sparing no expense and applying maximum resources to getting that done, as we've proven we can do in the first round.
Okay, thank you. I don't believe Sneha has a follow-up, so we'll go to our final question, Stephanie Smythe from CP24. Steph, go ahead.
Hi, everyone. I guess I wanted to follow up on what Dr. Davila said in her opening comments. The next few weeks, has to be all hands on deck. We just heard the questions about the vaccine clinics where there are lineups overnight, people camping up overnight. Is it time to adjust the model maybe here and open up overnight, have some 24-hour clinics so people can get in who desperately want to get that first or second shot?
Chief Pegg?
Hi, good afternoon, Stephanie. So let me start by saying this. So Mayor Tory just said it just a few moments ago. We have from day one had robust plans in place that are scalable such that we can increase clinic capacity, we can increase what we call throughput to match corresponding vaccine allocation. At this point in time, and I can say for next week, even with the addition of the 30,000 additional doses of the Moderna mRNA vaccine, that only puts our clinic operations next week at about 90% of their operating capacity. So there is still more capacity. With respect to the different operating models, I think it's important to understand that when we designed and set up and ultimately built and run the 9 city operated clinics, those were designed with a particular operating model. And one of our principal strategies that we have employed throughout has been to do everything we can do to minimize lineups and to maximize what I describe as client experience and make sure that there is a relevant or a relatively expedient flow through the clinic. They've worked really, really well. The clinics are effective, they're safe, and generally speaking, very positive feedback from clients. But as this situation and as the COVID-19 pandemic has evolved, and especially our immunization task force efforts in response to it have evolved, we've learned a lot and continue to learn a lot, especially from our Ontario Health Team partners and our community ambassadors. And I can speak very personally that I have learned a lot from our community ambassadors in that while there is a certain segment of our population, a certain percentage of people who prefer to access an online or a telephone booking system, book a confirmed appointment, arrive at a specific time, receive their vaccine and leave, that isn't necessarily the preferred option across our whole city. And our community ambassadors have made it very clear that in many of our communities, people feel more comfortable and are actually more likely to go and get their vaccine when it is a community environment in a place they know, where they are seeing and having the chance to be with members of their own community and family and friends who are both waiting and involved in the process of getting vaccinated, as well as taking part in the operation of those clinics. What that says to me and what that has taught us, and that is reflected in everything we talk about at our immunization task force, is respecting the diversity and celebrating the diversity that exists across our city. And that means making as many different opportunities available as are possible. And really that's what we're seeing. And when I look at every single morning, there's a press release that goes out that details out the dozens, oftentimes more than 40 or 50 clinics happening in a day. There is a plethora of of delivery models, different locations, different strategies, and all of that, I would suggest, combine to have been highly effective. So from a city operation standpoint, the 9 city operated clinics that really are the backbone of immunization clinic operations, we are ready to expand if and when the time comes, the demand comes, and the vaccine comes to support that. Until that is the case, we're certainly working hand in glove with our Ontario Health Team partners, our community health partners, our mobile clinics, the sprint strategy, and everything else that creates that really synergistic system across the city that I'm proud of.
Great, Chief, thank you. I guess my next question, Dr. Davila, or whoever wants to answer this, it's about this Delta variant. The concern obviously is there, looking at the UK experience, delaying the reopening. Can someone, maybe Dr. Davila, let us know the status of the Delta variant in the city of Toronto and any areas of concern?
So, Steph, at a very high level, we are certainly seeing Delta variant here in the city. At last count, I think it was roughly about a third of the samples did come back as Delta variant, and we are continuing to watch that very carefully. On the plus side, as I mentioned in my remarks, the science is showing us that vaccines are effective protection against Delta variant, and we're talking about 2 doses of vaccine. That's why you hear us say over and over again how important it is that all of us in the city do our very best to ensure that those in our networks, our family members, our friends, our neighbors, our colleagues, are actually taking advantage of the many vaccination opportunities that are available. We know the vaccine is effective. It is a significant part of our path forward so that we can move to a life that is more like what we knew before there was COVID-19. So I just, can't say that enough. For those of you out there who've gotten your vaccine, that's great. If you need to get that second dose, as soon as you're able to do that, please do that. And I would encourage you to help people that you know. Call them. Find out about whether they're vaccinated. If they haven't been vaccinated, please do everything in your power to help them get there, to book that appointment, to get to the clinic, and to get that protection that's provided by vaccination. It's protection for them, it's protection for all of us, and it's a key component of the path out of the pandemic.
Right, thank you very much, Doctor, and thank you all for joining us. That concludes today's briefing. Stay well.